You know, receiving a diagnosis of Peyronie's disease, it can be absolutely overwhelming. As a urologist, I sit across from men every single week who are carrying this really heavy, very silent anxiety. They're in the exam room, often feeling kind of embarrassed or isolated, but their biggest fear isn't actually just about the changes to their body. The question really weighing on their heart is about their future, and specifically, their ability to have biological children.
If you're worried that a Peyronies diagnosis will prevent you from starting a family, here is a vital medical fact.
Okay, let's dive into this. Peyronie's disease does not cause infertility, period. It's completely separate from your reproductive system's ability to create life. Think of your testicles as completely unharmed, 100% healthy factories that just make sperm. Your hormone levels, totally untouched. Your sperm count and quality are absolutely fine. The condition we're dealing with here is strictly a mechanical issue, not a biological one. So, while a physical bend or discomfort might make the actual act of sex difficult, the machinery making you a father, it is perfectly intact.
Section 1. What is Peyronie's disease? The reality of the condition.
So, the root of this condition, which, by the way, up to 1 in 10 men might experience, so you are definitely not alone, comes down to what we call Peyronie's plaque. Now, I know the word plaque can sound pretty scary, but let's make it crystal clear. This is just benign, non-cancerous scar tissue. That's it. It's not a tumor, it's not an infection, and there's no way it's a transmittable disease you can pass to a partner. Inside the penis, there's this thick, elastic membrane. Sometimes, through completely normal, vigorous sexual activity or even sports, tiny micro-injuries happen in that membrane. Most of the time, you wouldn't even notice them. But in some guys, as the body tries to heal those tiny injuries, it kind of overreacts and lays down thick scar tissue. And that scar tissue is the plaque.
Let's move to and see how this builds over time, because understanding where you are in this timeline is really absolutely crucial. Peyronie's happens in 2 distinct phases. First up is the acute phase, which typically lasts anywhere from 0 to 18 months. During this time, inflammation is active, the plaque is forming, the penis starts to bend, and you might even feel pain without an erection. Then you transition into the chronic phase, usually around that 12 to 18 months mark. This is when the condition stabilizes, the curve actually stops getting worse, and the pain usually fades away. Knowing which phase you're in helps us figure out the exact right way to help you.
Section 2. The real obstacle. Understanding the mechanical hurdle.
So, you might be wondering, if my sperm is totally healthy, why does the idea of fathering a child feel so impossible right now? Listen, your feelings of frustration are completely valid. The actual barrier to starting a family here is purely mechanical. When you have a stiff, unyielding patch of scar tissue on an organ that's literally supposed to stretch and expand, it causes a noticeable curve or bend. It can cause significant pain or discomfort during an erection. And because that scar tissue can mess with blood flow, it can also lead to a loss of rigidity, which is essentially a form of erectile dysfunction. You might even notice a shortening or a narrowing, kind of like an hourglass shape. These are all physical hurdles that simply stand in the way of having normal intercourse.
Now, what's really interesting about this slide is this specific number right here, 30 degrees. When we look at treatment guidelines, a curve of more than 30 degrees, which visually looks a bit like the hands of a clock pointing to 1 o'clock, is typically the threshold. That's when sex goes from being maybe just a bit awkward to becoming physically painful or genuinely obstructive for you or your partner. It's a very real, very physical roadblock.
But, the physical hurdle is really only half the story. We have to talk about the emotional impact, because the psychological toll of this disease is huge. Up to 50% of men with Peyronies experience depression. It brings on high anxiety, immense stress, and some real strain on your intimate relationships. Feeling ashamed, feeling broken, or just feeling way less confident, those are incredibly common reactions. But I really need you to hear this. You are not alone. It is not your fault, and most importantly, there is a clear medical path forward.
Section 3. Moving forward with treatment. Your path to family planning.
And this brilliantly illustrates how we can fix this mechanical issue using standardized medicine. Because this is a structural problem, we have fantastic, highly treatable action plans to fix it using real FDA-approved tools. Number 1, non-surgical injections. We can inject a specific enzyme, like collagenase, directly into the plaque to literally break down that tough scar tissue and improve the curve. Number 2, mechanical traction therapy. This uses devices to gently and safely stretch the tissue over time to help straighten things out. And number 3, corrective surgery. If you're in that chronic, stable phase and the curve is severe, highly successful outpatient surgeries can straighten the penis. We use standardized medicine here, guys. You absolutely do not need to rely on unsafe, unverified internet products. We have real science to fix the mechanics.
So, the ultimate question is, are you ready to take the next step toward fatherhood? Remember, your biology is working. Your ability to be a biological father is completely unharmed. All we need to do is address this mechanical barrier. With the right medical care, your dream of starting a family is absolutely still on the table.
If you'd like to learn more about Peyronie's disease and your treatment options, click the link in the description below. Because taking action today, that's exactly how you reclaim your tomorrow.